There you go. Okay. And let me first of all say to everyone, thank you very much for joining us. We really do appreciate it. Tonight's webinar is being live streamed on Facebook, so you'll be able to see it there afterwards. And I do want to point out that as a follow-up to this webinar, you'll be getting an email that'll have a link to a YouTube video of the webinar. You'll get a copy of what we call a flip book, or a link to a flip book, which allows you to see all the slides, so you can actually go through and review the slides. So instead of having to take copious notes, you're able to look at that and be able to follow what's going on. Because I know sometimes these seminars are ones where folks go back and say, gee, what exactly was said and how does that work? And again, we provide that information for you. It also gives you information about the resources that we use and different tables, like we'll talk about terpene tables and things like that. This is part of a webinar series. This is Know Your Options is the webinar tonight. Next week, we have one on sleep, and so how to improve your sleep with medical cannabis. And then on November 16th, which is in 2 weeks, we actually have a very interesting day. We're going to have a seminar in the Villages. So if you're in the Villages area here in Florida, please join us. We have two live seminars we're going to do in person, one at 9:30 and then one at 1:30. You can sign up for that again on our website. And then that evening, because of the fun that we had with Hurricane Ian, we pushed the terpenes webinar to that evening. So I'll be kind of busy that day. We'll be doing that webinar in the evening. And that'll end our seminar series for this quarter. We will be announcing next week the seminar series for Q1 of 2023. We have some interesting and fantastic some interesting and new topics we'll be talking about. So stay tuned. We'll have more of that as it comes along. But let's jump into this webinar. For those of you that have seen this webinar series before, you're probably getting tired of seeing the slide, but it's something that I really think is really important. I think a lot of people wonder, what's the big deal about cannabis? Why is cannabis talked about so much? And that's because it is a whole medicine cabinet in the plant. The plant has 450 medical properties that we know of. It has 120 cannabinoids that we know of, and it has 100 terpenes that we know of. So what it is it has a lot of potential to be able to help people with a lot of different medical conditions. And you can see over here on the right-hand side, this is a picture I took from a paper that was actually published by Normal, and we can put a link in our follow-up to this particular paper that you can take a look at. And it's a 75-page document that talks about how cannabis and the tests that have been done that show how cannabis helps with all these different conditions that you see here. But I think the most important part about cannabis is what they call the entourage effect. Cannabis, when you put cannabinoids together like CBD and also THC together, you get the thing called the entourage effect, which means they work together, they enhance each other. 1 and 1 is 3. If you put CBD and THC together, for example, for pain or for inflammation, it works better than working by themselves. I think you've seen that in Insa and with many of your patients, haven't you, Lisa?
Oh, absolutely. We have some experienced patients who come in, and since we do so much education about the terpenes in particular, they'll come in and they really love having a product that's high in terpenes for that reason. Because when you get a product with really strong cannabinoids and really strong terpene content, you get a really boosted effect from them working together.
Sure.
We like to say that the whole is greater than the sum of its parts. Mm-hmm. And so by having these guys working together, you're going to get, more of what you're looking for from products.
Sure. I do want to point out to everyone that we're here to really answer your questions. I know that a lot of people have questions about medical cannabis. They have questions about how to consume it. So please feel free to put your questions in the Q&A button, and that's right down over here somewhere. You'll see a little double box, a little double bubble, and we'll be following that. And don't feel free to ask questions. There is no bad question. We're here to answer questions, and that's what we're trying to do, is really educate and really make this something that's easier for folks to understand, and hopefully something that takes the mystery of cannabis away from what you're doing. So let's talk a little bit about the way cannabis is consumed. They call these routes of administration. And what it's done is it's actually broken down by 2 different categories. One is what we call location. So is it an oral substance? Is it intravenous? How is it actually used? And then also, where does it target? Does it target, for example, is it a topical? Is it something that you're going to look at for internal, gastrointestinal tracts. What are you trying to do with it? So there's a number of different classifications that both the medical community as well as the legal community, like for example, the state of Florida uses to be able to classify the product. Here in Florida, it's broken down into a number of categories: oral, sublingual, inhalation, and topical. And I think it's something that's kind of fascinating. There is a difference between how you use it. And let's start with inhalation for a second, Lisa. I know that a lot of people love to get, they love to roll that joint. They want to get that blunt. They actually inhale it. And from what I understand, in fact, what I found out is the onset, meaning how fast it takes effect, is almost immediately. Within a minute or two, you'll feel the effects of it, and it'll last anywhere from 4 to 6 hours. And I think that's something that people take a look at and get used to. You have a number of products that fall in this category, right? Not just flower itself, rolling a joint, but also inhalers and vape pens, right?
Absolutely. And personally, I'm one of those people who cannot roll a joint to save my life. And so I love our vaporizers because there's very little work needed. You really just need to inhale. That's all you need to do. And
Mhm.
so these products are especially really good for those who need fast relief.
Right.
I know I use cannabis to help me with my nausea. And I know that when I'm feeling really nauseated, I don't want to wait around for that feeling to go away. I want it to, go away as quick as possible. And so having an inhalation product with a vaporizer pen is my personal go-to because it's so convenient and easy to have right next to the bed because I usually get hit with that nausea first thing in the morning.
Right.
It's really super convenient and really strong. These products are really high in cannabinoids, and so you're getting a lot of that, medication basically right into your system really quickly. And I love that about the vaporizer pens that we have.
Well, I think inhalation in general. I know I have in my case, my medical cannabis reason I use medical cannabis is primarily driven for pain management and also inflammation. I have 7 herniated discs in my neck thanks to an automobile accident and 2 in my back, and so that actually is not a lot of fun. And then, like all senior citizens, I've had a couple of knee replacements on each side, so pain and inflammation becomes something that's there. And I know when I wake up in the morning, sometimes I'll have a level of pain that could be as high as 7. And by literally grabbing a vape pen, taking a hit or two out of the vape pen within a minute or two, that level of pain drops all the way down to that's all the way down to a 1, which I think is just great. Now, vaping is different from smoking flower, but I do want to point out flower and tobacco are very different. There's no carcinogens in cannabis. Uh, Anything you put into your lungs, you always have to be careful. You have to be careful. But I think that, as we all know, there's been inhalers around for a long time to help people with lung conditions. And the same thing happens with cannabis. Cannabis can actually help with a number of lung conditions that are out there. So it's a very different experience, I think, than you have with tobacco. There is a spoiler alert that we'll talk about, that when you light up that cigarette, that blunt, and you put that 500 degree temperature flame to the end of the blunt, you burn off half of the cannabinoids, all the flavonoids, and all of the terpenes. So you reduce the medical efficacy of the flower down, that flower experience down about 60%. But what's fascinating is that still is a very effective method of consuming cannabis, and people have really found that it really works for them. So imagine something that's only 40% effective being that potent and being able to help people. That's the benefit of using medical cannabis. So the question becomes, why do you use vape pens, or why do you use concentrates in the vape pens? That's because what you're able to do is you're able to control the temperature, and you're able to keep all the terpenes, able to keep the flavonoids, and really get the full benefit of using medical cannabis. So this works very well, I think, just to get started. I know in my case, it gets me started, but it'll only last maybe an hour, maybe 2. I go over here to sublingual. The next thing I do is, right after I take a hit, I usually use a sublingual drop that I put under my tongue. And the reason for that is it takes about 20 minutes for it to work, but for my case, it'll work for 4 or 5 hours, meaning that if I use it in the morning, it'll take me into the early afternoon to be able to relieve my inflammation and also my pain. I may have a condition that does not go away. And so if I don't do something, if I don't constantly during the day take medical cannabis, I will get pain, I will get inflammation, which is something that I really don't want to do. And in my particular case, it takes about 20 minutes for it to work. And I know it works in my case for about, like I say, 4 to 5 hours. And the way it's working is by putting it into your mouth, it's being absorbed by the blood vessels that are in the different membranes that are there. And I think these are called, the way people use them is called tinctures and sprays. And I think you have a number of those at your location. Is that correct, Lisa?
We do. We have a few varieties of tinctures, actually. We make sure to have them in different ratios,
Mhm,
which means they have different levels of CBD versus THC.
mhm,
We have some that are THC only. We have ones that are half THC, half CBD, and the CBD content can even go up from there.
mhm.
And so, like, if you find that you're really responding well to CBD products, then we have that for you. If you find that you just need THC and that's all, then we have that for you as well.
Great. So I know that we have a question from Anonymous. It's how does smoking a joint affect your lungs? I don't want to really get into that right now. We only did that. Keep that question question up. I know we only just went into it. When we get into the flower part, I want to talk more about that if you don't mind. But that's an excellent question, and please keep questions coming. We really do appreciate it. So sublingual drops help me take me into the early afternoon. Let's talk about a couple of things that can help as well. Let's run over here to topicals. I know that one of the things that helps me quite a bit is to be able to put a topical cream on. Now I know, at least here in Florida, you're still pending OMMU approval for your topical cream, but it's something that's really effective. And like inhalation, it works almost immediately. And here where it says it works for 2 to 72 hours, it's a little bit misleading in that typically these will last the topicals will last 2 to 4 hours. If you put a patch on, some of the patches will work anywhere from 8, 12, and there's some patches on the market that'll last 72 hours, and that's where that comes from. It just has to do with using a patch that's out here. But topicals have been very effective. I know it helps sometimes if I do have a day where I've been strenuous work and doing a number of different things, and I get that pain in my neck. Actually, I put the topical cream, and it helps quite a bit. Have you seen that in your with your particular condition?
Yeah, absolutely. I mean, with my specific condition, I don't have as much pain to deal with, but my mother has also had knee surgery as well.
Mhm.
And so she was a little nervous about using a topical at first because she's very wary of all intoxicants. I like to joke that she has like one pina colada every 8 years, and that's about her limit. But I brought her some topical cream, applied it to her knee, and within like 10 minutes, she was like rotating her ankle and stretching out her leg and just had
Right.
this look on her face of, wow, this is really effective. And she ended up not taking any of the pain medication that was prescribed to her because it was kind of giving her some side effects that she wasn't too pleased with, and just started using the topical instead. And so that's one reason I have a soft spot for topicals, is because I know that there are people out there who really don't want that psychoactive cerebral effect that THC can provide. But when you're using cannabis in a lotion or a salve, then you're actually not going to get high from it. And
Right.
so you're still going to get those pain relieving benefits, but you're not going to feel inebriated at all. And so that's one big reason why I love our topicals, and they should be available soon. So
Right.
keep an
Well, I'm
eye out.
glad you brought up the subject of your mother, because my wife is extremely sensitive to THC, and she's been doing some walking. She's been we're getting ready for a cruise, so we've been doing some walking to get in shape. And
Nice.
I know her knee has been hurting her, and so we use topical creams, and it's really helped her quite a bit. It's almost a go-to now for right after before and after she walks, and it's really helped quite a bit. And she doesn't get the high that you would get normally from other things. Last but not least, let's talk about one of the favorite subjects of everybody, the orables and the edibles and the capsules. It's really interesting that edibles, we were talking before the webinar tonight about how they're really kind of trending, and there's a lot of talk about edibles. But one of the things that you got to be very careful about is when you take an edible, it goes into your stomach and it has to be metabolized in your stomach. And we'll talk more about this in that part of the presentation tonight. So, but typically it takes 30 minutes to 2 hours to work. And I would say on average about an hour. There's a kind of a saying that I'm a cannabis practitioner, and as a practitioner, I have a saying that says about the time you think it's not working, it's about the time you take another one. And that's where you got to be very careful. There's the famous stories of people that have basically taken a lot more than they wanted, and they've got high. They've got a number of different things that are there. The nice part about cannabis is no one's ever died from recreational or from medical cannabis. But you may get high, you may get dizzy, you may feel good, you may just enjoy the couch. It's just that everybody has kind of a different reaction to that. But the nice part about edibles is they last from 4 to 10 hours. And in my particular case, I'm a chocoholic. So just before I go to bed at night, I take a couple squares of chocolate, and I can actually get a good night's sleep. It helps me not only fall asleep, but it helps me stay asleep. And I think that's the real benefit of edibles, is the long-term effect. Now, I take them a good hour before I'm going to go to sleep, because otherwise, if I want to make sure I am staying asleep, but I don't want to take too much of it. And so that's something that's really there. You don't happen to have an edible story, do you?
Personally, no, but I did just hear a really great tip from one of our team members on how they like to consume. So we have some amazing chocolates here at Insa. They're really high quality, amazing, imported from Europe chocolates. And what she likes to do is she'll take a triangle or two and actually shave it over a small bowl of gelato or ice cream. And so she's got a nice little cannabis topping to her ice cream, and she has that a little bit before bed, and she sleeps like a baby. And so, yeah, so that's a really cool thing about the chocolates, is that you can sort of utilize them in fun ways and still get your medicine.
Sure.
I think that, s'mores are a great way, especially up here in the Northeast. We love our campfires. And so if you make a s'more out of some chocolate and you're going camping or something like that, you're going to sleep like a baby, even if you're sleeping on the ground. And yeah, we have some really amazing chocolates here at Insa. So we're pretty spoiled in that way.
Sure. So you hear, when we talk about how do people consume it, this is called routes of administration. And again, you'll hear different terms for this. For example, in the oral area, you'll hear about gummies, hard candies. There are teas, there are baked goods. There are actually people that bake cannabis into products. I heard a statistic. I saw it, I didn't believe it, but I did hear a statistic about a year ago that something like 22% of all the flour that was being used here in Florida is used to be put into an edible, one way, shape, and form. People are making their own edibles. I'm not sure that's true, but I do know that a similar number came out of California, where they were claiming that 16% of the flour that was being used was being used for edibles. And I know that I make my own, for example, sublingual oil, and I have made my own brownies. So I know that there's something that people do like to use, but those topics, those terms, I'm trying to match terms to routes of administration to make it easier for people to understand. So that's where that comes into play. I know that in the case of tinctures, there's also sprays, both oral and nasal sprays that are out that have been used quite a bit. And they're very effective. I think they're probably one of the most effective ways of using medical cannabis. And in certain cases, there's metered dose inhalers, which make it easy to be able to control the amount of medicine that you're taking, especially if you're just both taking it or you're trying to use it for a particular medical condition. Tell me a little bit about inhalation. It has a number of different names. I'll let you get down into the different types of names. In other words, the different concentrates that are there, right?
Yeah, and so concentrates are really awesome, especially if you're a medical patient and you've sort of built up a little bit of tolerance to flower, and you've noticed that you're maybe smoking a little bit more than you used to, and you just need a higher cannabinoid content. And so we have hash. That's basically a very, low level, basic kind of concentrate, where you're just taking the trichomes. That's the part of the cannabis plant that has the terpenes and THC and CBD, and you're compressing it. You have shatters, which are a translucent, glossy kind of concentrate, which is often dabbed. You have crumbles and wax, which are very similar. They're a drier kind of concentrate that you can either dab, put into electronic vaporizers, or you can even mix them with flour for combustion or vaporizing and get a really higher potency. Resin is another type of concentrate, tends to be a little bit wetter. And then rosin is what's called a solventless concentrate, which is what you do there is you're just basically squishing a cannabis product, either hash or whole flower, with a whole lot of pressure and a little bit of heat, and that's going to squeeze out all of the good stuff, almost like you're making olive oil. You're going to get like the best part of the plant there. And then, of course, vape pens are, they are filled with a type of concentrate that is really easy for those vaporizers to actually, turn into vapor so that you can inhale.
Yeah, and vape pens come in two different forms. One that you can actually buy with preloaded, or you can load it yourself. But we'll get into that when we get later on in the presentation. And then topicals, again, you've heard of the gels and creams, and they talk a lot about the different suppositories that are out there. I know that Whoopi Goldberg has put a product out on the West Coast to help ladies with their particular with different their times of the month and their conditions. And she's done a very good job and got a lot of accolades for that. I think it's something that's been very, very effective moving forward.
Yeah, a lot of women use cannabis to help with really bad, cramps or endometriosis. And so it's pretty cool. Like, you can even use an anal suppository if that's what you're using it for, and it will help you out. It doesn't necessarily have to be vaginal.
Sure, but and they're very effective, by the way. That's one of the reasons why people use them, is because of the efficacy. I know people with IBS have found that suppositories are one of the best routes of administration for that particular condition that's out there. One of the questions I always get is, why do we have so many routes of administration? I know that when we go to the doctor, we hear take 2 pills and call me in the morning type of thing, and there's not a lot of routes of administration other than topical and pills in the medical industry. This goes back to the fact that cannabis has been documented use for a lot of years, at least 3,000 years. We found that it's been used, and I'm not going to go through each of these, but I just want to let you know that a lot of this comes from the culture and from the use of it is what's generated a lot of the ways that cannabis, as we see today, is available up on the market. And I think that's one of the things that makes Western medicine a little confused about cannabis, because you can use so many different routes of administration where they basically have a limited number of routes of administration because of the testing that has to be done. So it's interesting to see there, but interesting enough, I want to point out that in the U.S. pharmacopoeia, this means the medical journal, the medical reference that the U.S., the AMA, the American Medical Association, used up until 1942 actually contained cannabis. And it was actually recommended, it was actually one of the top recommended remedies for a number of different medical conditions. Now, we're not going to run through this. We'll do it more towards the end of the slide. I just wanted to mention that one of the things that's nice about dispensaries like Insa is you can actually match the routes of administration to the products that you have. Is that correct?
Absolutely. And like you've touched on before, if you need multiple kinds of routes of administration to like match up with your day, you have that vaporizer first thing in the morning, and then you have that edible for continued relief throughout the day. We have a lot of different options for you. And what's really nice is that all of our team is trained very vigorously to be able to connect you with the right product. That's actually one of our core values, is that we always are trying to connect the customer or patient with the right solution. And so if you were to come in and have a conversation with one of our associates on when you're using the product, what you're using it for, we can definitely help you build a regimen based on your preferred route of administration. Because as you can see from the screen here, we have a lot of different options. Whether you need something super strong like a concentrate, or you're looking for something a little lighter, the THC content, like a 1-to-1 tincture. We also have 1-to-1 vaporizers. We have you covered, which is really nice.
There's 2 things I want to point out right on this. All the packaging is all white, and I think that's because that's dictated by the state of Florida. But if you go to your website and you take a look at Massachusetts, other sites like Pennsylvania, the packaging is in color, but it's the same product. Is that correct?
Yes. We might have some little variations from state to state. For instance, there's a lime chocolate bar in Florida, which I'm a little jealous of because we don't have that up here in Massachusetts, at least not yet. But for the most part, we have a pretty standard lineup for you guys.
Sure. So I think that's one. The other is, fun fact, Insa, what does that stand for?
Insa stands for indica and sativa put together. And part of the reason why that's our name is it shows our dedication to having world-class hybrids. And our cultivation team is consistently actually creating brand new, never seen before cultivars and strains in order to, get certain terpene profiles that may be missing from the market, or certain flavors or things like that. And so we have quite a few, different options that are actually Insa exclusive, which is really fun to have.
I think that's really cool. I think
Yeah.
that's really cool. Anyway, let's jump into sublingual drops. Sublinguals, they could be called tinctures, they could be called oils. What they do is, again, they go, as we mentioned earlier, they go under the tongue or in the mouth. I took a course, actually I have a certificate in cannabis, healthcare, and medicine, and the professors were actually talking about swishing it around your mouth as opposed to putting it under your tongue. I think either way works very, very well. I think that's because what it does is it gets absorbed into, you can see the different glands that are here, gets absorbed into your bloodstream, and it's very effective. In my particular case, it works in about 20 minutes. But I think the thing that's really important is how much do you take? And these are the eyedroppers that you see. Some of the eyedroppers have lines on them and some don't, but you can see there's different levels as you're dosing. You always go low and go slow, but you can see it depends on the level that you need for that particular product that's there. And again, getting absorbed into your bloodstream works very, very effectively for anywhere between 4 to 6 hours. Do you use any tinctures?
I have actually. I've used them both sublingually, as you mentioned, and I've also used it to infuse something. And so that's one thing that's nice about tinctures, is that you can sort of use it to infuse something. Like I used it to, we had a very limited time only hazelnut tincture, and I used it to infuse a hot chocolate.
Oh, wow.
And it was really awesome. It had, infused hazelnut hot chocolate. And so that was a really cool way to actually ingest.
Yeah, and I
And
was going
what's
to mention that a lot of people put the tinctures into their not just chocolate, but also their teas and their coffees.
Yeah, it's, or like I've even heard people putting it into things like salad dressings.
Mhm,
And so if you need a little medication throughout your day and you're having a salad for lunch, you can just pop a couple drops inside your dressing
mhm,
and you're good to go. And what's
right,
nice about our tinctures as well is that we actually have each serving size be a single drop. And so it's a little bit easier to dose out, as
right,
opposed to like, looking at the eyedropper and,
right.
making sure it's at the right milliliter level. You just
Mhm,
count the amount of drops that you're putting in there or putting under your tongue, and,
sure.
check out that label, and you're going to have a really good idea of what you're ingesting.
That's great. I know that this is a very effective way of using cannabis. That's one of the ways I recommend people start using cannabis, is using tincture drops, because they are easy to control, and really you really don't get much. It's you don't get much kickback from them. Meaning it's not something that's gonna it's hard to do. It's very simple to do. Now,
Yeah,
when you're
very user
dosing
friendly.
tincture drops, we have this terminology that's used in the industry. You'll hear about 1 to 1, you'll hear about 20 to 1, you'll hear about 12 to 1, you hear about 1 to 8. What does all that mean? Well, the first number is how much CBD is in it versus how much THC is in it. So think of it like here, if you have a 20 to 1, you have 20 parts of CBD and 1 part of THC, or 1 part of, down here, you see 1 part of CBD and 8 parts of THC. These are used in that formula. For example, 1 to 8 is really great for addressing pain and PTS. 20 to 1 is something that's really great for addressing anxiety and inflammation. My wife uses a 12 to 1. She's found that very, very effective. In my particular case, because I'm trying to deal with pain, I found that 8 to 1, 4 to 1s work very well. Candidly, so do 1 to 1s. And so it's interesting. It's just a matter of the time of the day, how my body feels, what I'm trying to address that particular point in time. But I do want to have it. I do want to have people understand that this is where the ratios come into play. You'll hear the word ratios. This is what we mean by ratios. Now, nice, cool little usage tip down here. Tinctures taken with food may take longer. They fall into the edible category.
Right.
So you drop it on your salad. Don't expect it to work in 20 minutes. Probably work
Right.
in about 30 minutes to an hour. That's a nice way of saying, if you load up your salad, you're not getting anything out of it, don't go adding a whole bunch more. Give it time. Be cool.
Yes.
Just be patient. Okay. that's always there. I mean, I have a number of famous and funny edible stories, including my mother, which I won't go into, but it's kind of interesting to see the different ratios. But this is where the word ratio comes into play. Now, let's go over to inhalation, because here there's a number of different ways you can inhale. You can do a blunt, you can take a concentrate, drop it into a vape pen. They have cartridges, we call them oil cartridges, that are over here. You have a number of ones that are over here. The nice part about it is they work very effectively. I know that when I had my auto accident, this is probably about 6 years ago, I was in a lot of pain. And when you have 7 herniated discs in your neck and 2 in your back, it is just absolutely no picnic. They did give me a lot of, this is say pharma drugs, I got the classics that everybody knows about, but they got me. I mean, I literally was at a point where I couldn't sit on the couch. I tried them for a day or two, and it did help with the pain, but it didn't do much it just made it hard for me to just function. And so I found I turned to medical cannabis, obviously being in the business. I got a prescription and I started working with it. And I found that I was able to manage my pain without basically by being able to stay focused and being able to do my job. What I find amazing, and again, even when I did it this morning, if I wake up and I'm in pain, in my case this morning I was at a level of 5, I take 2 hits out of the vape pen and it drops down to a level of 1. It's like somebody takes a rag, wipes my back, and all the pain goes away. I just find that to be just absolutely amazing. I don't know if you've had that experience or not, but
Absolutely, I have. I've used cannabis vape pens to help with pain when I've had painful conditions in the past, specifically kidney stones, which are not fun at all. So drink
oh
your
wow,
water.
wow,
Uh, and it brought me a lot of relief.
yeah,
And I know a lot of people who have been prescribed things like opioids, and eventually down the line, they start taking the opioids just so that they no longer feel the withdrawal off
right,
of the opioids. And you
right,
don't really get that with cannabis. And so there's a huge benefit to using them.
right. Now I know that a lot of people get concerned about the safety of vape pens. There was about a couple of years ago, there was some, especially in California, they had some folks that were buying vape pens from a non-licensed dispensary or non-licensed facility, let's put it that way. And they were foreign, they were brought in from foreign countries. They weren't tested, and they killed some people, to be candid with you, because
Yeah.
they had basically bad products in there. I want to point out that state licensed dispensaries like Insa here in the state of Florida, whether you're in Florida, you're in Massachusetts, Ohio, Pennsylvania, wherever you're at, they are very, very strict testing methods. You're tested twice in-house and 1 outside the facility. So that there's 3 tests done on that product. No one has ever died from a vape product from a state licensed dispensary. They're absolutely safe. In fact, I would say they mainly go somewhat overboard on the testing, which is okay. But I think that's one of the things that people ask for, and it's something to really, really note that's out there. Now, one other secret that's up is called the secret breath. I don't know if you heard about that. You know what that's all about?
I've heard of it, but I've never heard it called that. And I really like that. I think that's a really neat name for it.
I'm a big follower of a gentleman named Dustin Sulik, and he's the one who kind of coined this phrase. And what you do is when you're using a inhalation product, right after you inhale it, just wait for just a quick second, and then slowly take another breath. Inhale a second breath with no vape at all. Just have it be all air. And what it's doing is in your mouth, in your all the canals that lead down to your down to your lungs, it still has some cannabis in there. And what you're doing is you're actually forcing that to go down into your lungs and being able to help you. It actually works. I
Mhm.
was kind of surprised when I first heard about this about 4 years ago. And it's something to pay attention to. It helps you get more out of that vape pen, but also it becomes more effective to be able to help you with, again, whatever medical condition you're trying to address, whether that's pain or inflammation or whatever. It really does help quite a bit. So secret breath is kind of one of those secret tips that a lot of people may not know about, but something you may want to take a look at. Capsules. Capsules fall into the edible category. And there's something that people are very comfortable taking. I mean, capsules are something that we've taken, since we were kids. And it's very something that everybody really knows what it's all about. But it's interesting that when you take the capsules, going back to what we said earlier, they will take, in certain cases, up to 2 hours to be able to work. although they work for a long time, they work 4 to 10 hours. And people say, why do they work so long versus other forms of cannabis? And that's because when the product gets into your stomach, the delta 9 THC that's in that particular product gets converted over to something called 11 hydroxy THC, probably one of the most effective THCs that are out there. Now, a lot of people vilify THC because they get high. THC is really important to address pain. It's really something to help with certain conditions like head trauma, PTS, those types of things. And it helps quite a bit to be able to help with neurological problems. If you have neurological problems with this fibromyalgia, Parkinson's, things like that, it really helps quite a bit. And so really the capsules really provide not only an effective way of taking cannabis, probably one of the most effective ways of taking cannabis, but also gives you the longest duration that's out there. But I would say start with one capsule, and then depending on your condition, titrate up. I know in my condition, I have to worry about 24-hour coverage. So it's something that's where I take my my edible in the evening to be able to really carry me over to the morning that's out there. But there's a big chance of over consuming with this one. Is that correct?
Yeah, it's like you said, people will consume it. They'll not feel anything right away.
Mhm.
And so then they'll just like take another one, and then it'll all hit them all at once and they'll have some unpleasant experiences.
Mhm.
And we don't want that. You don't want that. So we always say when it comes to any sort of edible or ingestion method to start low and go slow. And so start low. So, like it says here, start with just one capsule and then go slow. Wait
Mhm.
that full 2 hours before you have more. Because you
Mhm.
can always have another capsule down the line, but you can't undo one. And
Mhm.
so just be really careful with that.
Sure, it's there. Famous edibles. I know that edibles are kind of cool. I know that a lot of people they enjoy them. I know my mother, which 4.5 years ago, she was diagnosed with breast cancer at the age of 88. And the doctor immediately wanted to operate chemo, radiation. Um, and in my world where I grew up as a kid, cannabis was considered to be an absolute no-no. When I got into the cannabis business, my mother thought that Darth Vader had arrived in the family. Um, and of course, when she was diagnosed with cancer, it was like, Mark, what can you do for me? And we actually put her on a number of different things. One of them is she now uses a lot of edibles. She's kind of the edible queen right now
Nice.
because they're easy for her to carry around. She knows how to use them. She's got experience with them now. Her gummies, and she's a chocoholic like myself, but the gummies and chocolates help her quite a bit. But it's something that you have to be very effective with. It also can be infused into things like butters and oils. This is where people make their own products. Cannabis butter is something that's very popular. Cannabis oil is really used, as you mentioned, for salads, and for cooking and things like that. So
Mhm.
it's something that's out there. If you're thinking about cooking, I worked with and done some webinars with a lady by the name of Sherry Cannabis. I consider Sherry Cannabis to be the Martha Stewart of cannabis cooking. And if you go to this website, you can get a dosing calculator from her that will actually help you figure out what you put in and what you don't put in, that's out there. She also has a great cookbook, a gourmet cookbook. She is a gourmet cook. So it's not something where you're just making cookies and brownies. She makes pastas, she makes meat dishes,
Nice.
fish dishes. She does a really good job. I really like what she really does. Let's answer a question. I know Edie asked a question. It says, my medical MJ doctor told me that because because my gallbladder is out, that edibles won't be as effective. He did explain why, but I'm not sure I understand this. What is your opinion? Well, first of all, if you have your gallbladder removed, it's actually very simple. Not all of the parts for your digestive system are all there. So you're missing a very important ingredient. I think the operative word is won't be as effective. Edibles will be effective for you. Will they be 100% effective? The answer is probably no. And I think there's going to be somewhere between 50 to 70% effective, as opposed to when you have your gallbladder that's there. It's there. I would not shy away from edibles because, again, if you're looking for that 8 to 10 hours, especially if you want to make it through the night, get some sleep, just relax, it's something that really is something to take a look at. You may just need to take more. Best way of putting it. I think that's that. So your dosing becomes important when you're in this particular condition. So I wouldn't shy away from it. My opinion is don't shy away from it. Take a look at the fact that if you are missing a few of the key components in your digestive system, that you may need to take a little bit more, but it will be effective. It'll probably be 50 to 75% effective is what's out there. You have some comments?
Yeah. Yeah, actually, we've talked to a lot of patients who have that problem, and personally, that's why I don't have an edible story, is because I have a bum gallbladder, and so edibles aren't as effective for me. But what has worked for me, and what has worked for other people who do not have a gallbladder, or the gallbladder is just not functioning properly, is trying a fast-acting edible. And so a fast-acting edible is a little bit different than these traditional edibles, like your chocolates, like your gummies and things like that, in that it is formulated to actually absorb the cannabinoids like in your esophagus. And so it's bypassing the digestive system for the most part. Now, the thing about fast acting edibles that is kind of the trade off is that, yes, they do work faster typically than your traditional edibles, and they can be more effective for those who, have gallbladder problems, but it's not going to necessarily last as long as those traditional edibles because it's not traveling through your digestive system and having that conversion that's going on in your liver. And so if you can find a fast acting edible, oftentimes you'll find them in seltzers. And sometimes you'll even find them in certain like capsules or even mints. Then that actually might be a really great option for you as well.
They're making some tonics and some powders that you can make, and you add water to it, and it makes it. And in there, I think those are kind of fast acting as well, right?
Yes. Yeah, it's an interesting process is how they, change the THC molecule ever so slightly just to make it easier to absorb in the esophagus. They're basically breaking it up into smaller bits, and so the molecule is smaller and can pass through those areas easier. But yes, they are, it's crazy. They're creating new products all the time, and fast acting edibles is definitely one of the categories that I feel like is expanding really quickly nowadays.
Sure. Now, dosing becomes very important in the case of edibles where it says go low and go slow. I love the fact you'll tell someone, like, take just one of these squares of chocolate and then wait about an hour or two. The chocolate tastes great. I know that the chocolate that comes from your company, which is Insa, is European-based chocolates, and so they taste great. The temptation is to try it more than one. Be cool, because just wait that hour or two that's out there. Nobody's gonna die from this, but you can get to that point where you're beginning to feel, how should I say, you get anxiety, you get anxious, you get high. Okay, you may want to sit on the couch a little bit more. You may get hungry. I mean, you can. I know Michael asked a really good question, and his question is, are all gummies created equal? As in, based on gummies made from plants and some strains are different, can gummies affect you differently, say from different companies? And the answer is absolutely. Not all gummies are created equal. There are, I think it depends on whether they're using gelatin and pectin as the base ingredient, for example. I think you hit the nail on the head with the strains that are out there. I know there are certain edibles on the market that I just love that also are not only, most edibles when they first came out were very high in THC. Now you're finding edibles that, I know there's one of them that I use that's 2 CBD to one THC, which is very, very effective. So there are different ones that are out there. I know here in the state of Florida, we have something to worry about. We have something called heat. And what you have to do is be careful that you don't buy an edible, put it in the car, and then you find out it's been melted. That happens. So here in Florida, you have to pay attention to how it's actually made. And I think that's something that, so the answer is no, they're not all equal. Please look at the certificate, a COA, certificate of authenticity or certificate of analysis, depending on which doctor you're talking to. And the COA will tell you not only what's in the product and how it's made. And a lot of times the dispensaries will tell you whether it's heat sensitive or not. And then also the terpenes that are in there. Very important to really pay attention to the terpenes that are in a lot of products. More and more terpenes are showing up in edibles. I know initially they were just chucking these things out on the market because there was such a demand, but I know that it's getting to be very sophisticated as to what the products are. You may want to pay attention to the labeling of the product and also to the COA. That's an excellent question, Michael. Do you have any comments on that, Lisa?
Yeah, so if you're looking for something that is maybe not just pure THC and does have the terpene content, you're probably going to want to look for something called FSO, which stands for full spectrum oil.
Hmm.
And that's pretty much exactly what it sounds like. Instead of being one specific cannabinoid and that's it, it has the full spectrum of the plant inside of the, edible. I know that we have some full spectrum chocolates, on their way. And so that would be an option. I will just say, word of caution, if you're having a full spectrum product versus just a THC only one, the taste is going to be a little bit more dank, a little bit grassier. And
Mhm.
so if you do have a full spectrum oil product and it tastes a little bit more like cannabis as opposed to just pure chocolate or a pure drop, then that's because those terpenes are in there and they are present. Some people don't mind it, some people really dislike it, but that is just something to be aware of.
I had a marketing person once explain to me that it was called more natural taste.
Yeah,
Okay, it's out there.
yeah,
Very, very good tip though. A lot of this, if you buy something from a dispensary, it typically has more of a consistency in the edible than something that people make themselves. I know one of the problems when people are making edibles is they don't, for example, if you're making brownies, they don't stir it enough. They don't mix it enough. In other words, you want to spread the cannabis throughout all of the product. And a lot of people will try to short circuit it, throw a little bit in, do a quick smoke, do a quick mix up, throw it in and cook it. They'll find the middle of the brownie is very potent. The outside of the brownie has nothing. And so you got to really pay attention to when you're cooking, making sure that you're evenly distributing what's out there, that you do the stirring, you do the mixing, and those types of things a lot more effectively. And when you're doing that, I found that when I made my brownies, I had to had to make a couple of batches just to get it right.
yeah.
But I think I got the formula down now. That's really out there. It really
We
helps.
actually infuse our chocolate for 24 hours just to make sure that it's
Wow,
completely homogeneous. Yeah, we go overboard,
that's great.
definitely. You don't have to do it for that long if you're making it home, but we want to just make sure that we're being above and beyond thorough when we're making our chocolates.
Yeah, that's really cool. That's kind of interesting. Sprays. Sprays are very interesting in that they work almost immediately. And that's what I find. I mean, immediately within 15 to 20 minutes. A lot of times, a lot of these were developed initially for folks that were like for kids when they had epilepsy, you could be able to spray it in their mouth if they were having a seizure. But then what they found out was it's very, very effective in a lot of different ways. You can put it on the skin and let it absorb. You can use it from a nasal standpoint. You spray it in the mouth. But again, because it's absorbed into your body so effectively, be very careful. Okay. It does take anywhere between an hour to 2 hours to get full effect, but it will work 4 to 6 hours. And again, sprays are very reliable for what we call microdosing. And what's microdosing? If you're an athlete, they tell you don't eat 2 or 3 meals a day, eat 5 to 7 meals a day. Just eat a little bit during the day, help your body be able to absorb the foods that you're eating and really be able to help yourself fuel yourself. Now, that's something but cannabis works the same way. If you instead of taking drops in the morning and drops in the evening, if you just cut the dose, the same dose, but just cut it into smaller portions and just do it every, let's say 2 hours or 3 hours, you'll find it to be much more effective than just how should I say, taking that one drop at a time. That's why a lot of the patches work so well, because what they're doing is they're giving you a little bit of cannabis as you're going along. You're getting microdosed as you go along for that, that 8 to 12 or 72 hours that are out there. The sprays are much the same way. That really helped quite a bit. We talked a little bit about topicals, and again, when you put them on, they work almost immediately. But there's also a couple of different types of topicals. There's the topical that goes on, and there's also transdermals. You want to explain the difference between those?
Yeah, absolutely. So, like a lotion or a salve, you just apply it directly to the skin. And what happens is that the cannabinoids sort of stay within that lipid layer of your body. It doesn't actually penetrate to get the cannabinoids into the bloodstream. And so it's going to really affect the area that you apply it. And so, since it's not actually depositing any of those cannabinoids into the bloodstream, that's why they don't give you any sort of cerebral effect, is
Mhm.
because they're not, depositing that THC that will eventually get to your brain. It's just staying put. right where you want to put it. Transdermal patches are formulated to penetrate that lipid layer and to deposit the cannabinoids into the bloodstream. And so you technically can get a little bit of a cerebral effect with transdermal patches. But if that's what you're looking for an effect, it's probably one of the least efficient ways to do it. Because as Marc said, it's very small amounts that are getting released into your system hour by hour.
Yeah, it's not the best way to get high, but I can tell you, because in my particular case, I have, it has to do with my vertebrae in my neck and my spine. It is very effective. The transdermal patches work very well to be able to help with the pain relief and the inflammation that comes from both of those things that are there. Michael asked a question about sprays that I do want to answer before we go on. I know we're talking about topicals, but he says, is the spray going to do any damage if you get some into your eyes? I know it won't. I know you won't do it on purpose, but besides by accident, how bad would it be? It turns out that in your eyes, and it turns out in your face, you have a lot of CB1 and CB2 receptors, which is what cannabis looks for. Cannabis isn't going to hurt. In fact, it'll probably help you absorb the cannabis that's there. The answer to your question, I really can't answer it because it depends on the agent that's used in the spray. So if there's an alcohol that's in there, obviously putting alcohol in the eyes you'll sing. There are certain others that people use, like MCT oils and certain other things like that, that really won't hurt your eyes. So really take a look at, to answer your question, Michael, take a look at what they use is what we call the cutting agent for that particular product. And that'll help you understand if it's going to be able to hurt you or not. Typically, the cannabis won't, but just pay attention to what other ingredients are in the spray to be able to answer that particular question that's out there. The other question you had is on topicals. Normally from a dispensary, if you eat some, it would just be other chemicals that would make you feel ill. The answer is yes. I don't recommend eating topicals, primarily because a lot of times in the lotions, the creams that they put in there are much like beauty creams. They're not designed to be eaten. They're designed to go into your body, and especially the transdermal ones have some properties that are really designed to really get into your system. So typically, I would say stay away from eating it. If you happen to lick it off your skin, you're not gonna cause any major problems. Let's put it that way. I would say stay away from it. I find it interesting. People do have some good, and by the way, Michael, thank you for the question. There is no such thing as a bad question. And I think it's interesting you bring these up, and please do, because I know a lot of people do have that particular question. Let's go down to transdermal patches. I'm a huge transdermal patch fan. I have to tell you, I probably use transdermal patches. I use them every week. That's the best way of putting it. And the reason for that is because in my particular case, I have to have 24 hours of coverage to be able to really handle the inflammation and to handle the pain that's in my neck. If I don't, with 7 herniated discs, it can hurt. Let's put it that way. So I will use a transdermal patch at least once a week. I put it on. It's supposed to last 72 hours. Sometimes it lasts actually longer than that. But I actually can do that, and then I can augment it with other forms of cannabis, the inhalation and different tinctures to be able to offset that microdosing. But I'm a huge fan of transdermal patches that are out there, and I know that these are just really coming on the market, and they're kind of new to the whole industry. But it's something, if you can find them, pay attention to them, because they will help you quite a bit. It's there. Let's talk about the famous. Flower. Okay, I have a good friend of mine who I do some webinars with. He's actually a veteran, and he told me that he just loves rolling a joint. There's a therapeutic, there's a therapeutic benefit to grabbing that flower, rolling it into a joint. This is his deal. And I know here in Florida, I think Chris Cano in Suncoast Normal is actually having a blunt rolling contest. I think it's in early December, who rolls the best blunts. Nice. And so there's a lot of talk about that. I really think it just depends on what you really like. I know when I grew up as a kid, I really don't roll joints. Just call me lazy, but I use this little device here called a Mighty Plus for my flower, and I'll explain why in just a minute. But it has to do with the fact that the minute you put that 500-degree temperature to that joint, you're burning off half of the cannabinoids, all of the terpenes, and all the flavonoids, and you're just reducing the medical efficacy. And in my case, I'm not smoking it for recreational purposes. I'm smoking it for medical purposes. I want to be able to control my pain and my inflammation. Now, the nice part about using what they call vaporizers here is you see on here, there's temperature settings. So by being able to set that temperature, in my particular case, my favorite setting is 365 degrees. I get the maximum amount of cannabinoids produced, and I get the right terpenes I need for my particular condition. Because if I go too much higher than that, then I burn off some of those. And if I go below that, I don't get the terpenes that I'm looking for. So it just depends on how you want to dial it in. And what I love about being able to use vaporizers is you can dial those in. I think you've seen that, and I think you handle some vaporizers. You sell some of these, don't you?
Yeah, we sell some that you can dial in even through like a Bluetooth connection with your phone.
Mhm.
And so if you really love that, linalool, and you want to be able to get all of the linalool out of that plant, you can dial it in for, the best vaporization rate for that terpene that you're looking for.
Yeah, and for those of you that love rolling joints, I'm not anti-joints. Okay, it's
Yes.
just my preferred method is more like I'm into getting the best bang for my buck, so I go with the vaporizers. But I do have to admit they're fairly expensive. I mean, it's not something
Yes.
that some paper is a lot cheaper than buying these vaporizers, that's for sure. But over long term, I find it to be very effective for me. One of the other questions that people have is, can you consume raw cannabis? What's your thoughts on that, Lisa?
Well, yes, you can. But if you're looking for a lot of the traditional effects of cannabis, then you probably are going to want to decarb it first.
Mhm.
But for those of you who want to eat it raw, much like a salad, you will avoid that high or the inebriating part of cannabis, which is great. And you're still going to get those terpenes and those flavonoids. And actually, fun fact, cannabis was originally, like thousands and thousands of years ago, used as a food source.
Mhm.
And it actually is a really great complete food source, because not only are you getting your roughage and your fiber, but you actually can get a lot of protein if you're making like a meal out of the seeds. And you can get a lot of lipids, because the trichomes, where the cannabinoids and terpenes are created, the frosty part of a flower bud is
Mhm.
actually has a lipid layer surrounding each one of those little trichomes. And so you're actually getting a pretty complete food source from it.
Mhm.
And so some people, I've seen videos of people who actually like juice their cannabis in order to get really high amounts of those cannabinoids without the high. Because if you were to have 1,000 milligram THC decarbed shake, you would be to the moon high as a kite. But if you don't decarb it and you're just having it as like a smoothie without adding that heat to it, you can consume a lot more of it and still get a lot of the anti-inflammatory and pain relieving benefits.
Okay, now you used the term a couple times. I want to define it. Use the word, we call it let me get my lips together here. Decarboxylation. That's what it's officially called. And what
Yes.
that's doing is you take the cannabis in its raw form, in its flower form, and when you heat it, it turns the THCA into THC. So that's actually the way cannabis is made, is they either heat it or they age it to be able to have the flower. When it first starts, it's CBG, and then it morphs into THCA and CBDA. And then what it does, then after time and heat goes into THC and CBD. But if you don't heat it over 300 degrees, it stays as THCA and CBDA. And it's actually very effective. I make a tincture drop. I have a thing called the magic butter machine, where I'll take cannabis, I'll put it in the machine with some with some MCT oil, and I'll cook it at 160 degrees for 10 hours. And what that does is it creates a tincture oil that's very high in THCA, which is great for pain. Again, with my herniated discs in my neck, that helps. Very high in CBDA, which is great for inflammation. Again, if I get the inflammation down in my neck and my knees, I feel a lot better, the pain goes away. But it has no THC in it. It has no CBD in it. So I'm able to use that in the mornings. I'm able to use it in the middle of the day and not worry about getting high or getting into a state where it could cause some particular problems. So if you're looking at eating it, I know that people have talked about juicing. cannabis, it's actually one of the most effective ways, and it actually is used very much to promote healthy hearts, help you with your immune system, and it's been known to help with vision. Which is very fascinating. There's some Israeli studies that have shown that it's helped quite a bit. And it also helps put a lot of healthy bacteria into your system. So the answer to your question is yes. Okay. But in many cases, the raw cannabis it isn't going to get you high. If you're looking at getting high, this isn't the way to go. But if you're looking at it for health benefits, this is definitely something that you may want to take a look at that's there. Now, before I jump off of this flower, jump into the next thing, which we're going to talk about edibles. Tony asked a good question. How does a vaporizer work? This thing over here. So the easiest way to understand it is, in the case of my particular machine right here, this little top basically unscrews. It has a little capsule that you put your flower in, and you drop the capsule inside and basically drop it into here, and you tighten it back up, and then you turn it on. And what happens is it heats it up to the temperature that you want. In my particular case, 365 degrees. Once you do that, you're able to draw from here and just smoke the cannabis. And that's how it works. I know these are these volcanoes, which a lot of people swear by them, although they're very expensive. I've never tried a volcano. Have you tried a volcano?
I have actually, yes.
Tell me about it.
So a volcano, instead of having like that little straw that you inhale, it has a bag that is then filled with the vapor, and then you attach a little mouthpiece to it. And when you put the mouthpiece to your mouth, you press it, and that actually releases the airflow. And so you can then inhale. And I've seen people like fill a bag and then wait a little while, go to the bag and inhale it, and it's still, has the vapor inside of there. And so it's not something they have to do immediately, which I think is really neat.
Sure. That's good. Yeah, so they're very easy to use.
Mhm.
They're very effective. I think the only thing that you do is, when you got to understand that when I put that little capsule into this little thing, it works for one session, meaning it'll probably work for maybe 10 or 20 draws, and then you got to put another one in, because it's a very small amount of cannabis that you're putting in there. But they're very easy to change, and they're very effective. That's out there. I really love it. I think this is a Stoke and Brickle unit. It's very expensive, but it works great, and I really like using it. So anyway, hopefully that answered that question, Tony, for you. Michael, you asked a great question, and that is, wouldn't a transdermal patch continually keep you stoned at a certain level? Then a gummy or smoking it would just get you more stoned and possibly not able to operate heavy machinery. Well, Michael, first of all, transdermal patches come in 3 different flavors: CBD only, 1-to-1 CBD and THC. So in my particular case, I have found that if I can reduce the inflammation in my body, I can reduce a lot of my pain. So most of the patches that I use are CBD patches, which don't have any THC in them. And so what I'm able to do is I'm then able to control the amount of THC. You mentioned gummies or smoking. Then I'm able to augment it with the THC that I need to be able to control the pain that I'm really looking at for that's out there. So pay attention to the type of transdermal patch that you buy. Now, there are times when I travel, which I'll be doing this weekend, and I'll be going on a 3-day trip. I'm going to speak at a conference in Mississippi. And so what's going to happen is I will actually put a 1-to-1 transdermal patch on, because again, being 1-to-1, that helps me be able to control my pain and also run inflammation. And then also I'll augment that with a vape pen or something like that to be able to help. Mississippi, it turns out that cannabis is now legal, which it wasn't before about 6 months ago. So it's something that you can use. It's what I'm trying to point out is transdermal patches aren't pure THC. Now you can buy some that are pure THC, and in that particular case, yeah, you got to be careful because you're putting into your body THC, but it's microdosing. It's just a little bit as you go in through the day. So it's not like it's this big rush of THC or CBD hitting your body. It's just enough to be able to manage your body is able to manage itself and be able to stay at that particular level. I recommend CBD patches, and I recommend 1-to-1 patches. And in cases where people are trying to work on or fight cerebral problems, high pain, that type I know when I had my knee operation, I had a knee replacement, and you want to have the definition of pain, go have your knee replaced. And I did use a THC patch for that because I was trying to manage the pain, and it worked very effectively for that. But you can imagine having a knee replacement. I wasn't driving or operating any heavy machinery. I was lucky to get up off the couch and make it to the bathroom. Let's put it that way. So it's something that hopefully I answered that question. But the answer is yes, it could if you just pay attention to how much you're dosing. That's what the key to cannabis is what are you using and what are you using it for? So I hope that helps quite a bit. We talked about using dry flower. Infusing cannabis, we talked a little bit about this, putting it into homemade edibles. You want to talk a little bit about that, Lisa? Or you want me to take this?
Sure, I can talk about it.
Go ahead.
So if you want to, try your hand at making some homemade edibles, then you can, do it two different ways. You can either use that raw flour and do it at a very low temperature, like you were saying you do with the magic butter machine. But if you want to make sure that you're converting that THCA to THC, you're going to want to, do that decarboxylation first before you infuse anything. And so, a very classic way to do that is to grind up your flour material, put it onto a baking sheet, put it into the oven, usually around like 275 is what a lot of people recommend, Fahrenheit, and keep it in there for about an hour. That way you're doing a really low and slow decarbing and you're not necessarily like burning anything off.
Right.
And then what you can do, one way that I really like to do is using a crock pot. You can put your crock pot on low, put in your infusion material. You can use butter, but you can also use like coconut oil or vegetable oil, whatever you want to eventually use that product for. Like if you're baking, you might want to use a vegetable oil or a coconut oil. If you want to use it to smear on your toast in the morning, then you're probably going to want to use a butter. And then let it sort of transition from the flour to that medium over some time, usually a couple hours. And then what I always recommend doing after that is straining the flour material, because none of that good stuff is really left over in the flour material. And the texture of it can be not so great if you're making a pan of brownies or cookies or what have you. And so go ahead, strain it through a sieve. You don't have to go nuts and put it through a coffee filter. That's a little overboard. Yeah. But if you have something like cheesecloth or just a fine strainer, that'll be good. And then, in the case of butter, keep it nice and chilled. In the case of vegetable oil, you can probably keep it on the counter. And just keep in mind that the duration of, the effects of the edibles that you create are going to be a really good long while. Yeah. And so definitely use that calculator that you had on the previous page.
Right. Here's sherrycannabis.com, right?
Yes, exactly. Because then you're going to be really, better prepared for understanding how much cannabis or THC or CBD is in that pan. And even still just take a tiny bit of it first and try it out before you go ahead and have like a couple brownies. Take a little bit of sample, get an understanding of what the effects are going to be, and then you can move on and start to integrate it throughout your day.
So, fun fact, you were mentioning straining it off and getting rid of all that little all the little particles that are out there. Yeah. Now I take those little particles and I put them in a glass container. And when I'm making my smoothies, I drop them in my smoothie. And that's because you've probably heard of whole plant experience where you use the whole plant. So what I'm doing is I'm taking part of that whole plant and basically making my smoothie, AKA a whole plant smoothie that's out there. So,
nice.
Very effective. If you drop say a teaspoon or so into the smoothie, you really don't taste it that much. In fact, there's no taste at all. But I have felt the effects of the whole plant, put it that way. And how I feel the effects is because I have felt better from an inflammation and pain standpoint. Let's put it that way. It's out there.
Very cool.
So let's do something really cool. This is my friend Sherry Cannabis. She's got some tips on edibles. Let's listen to her little thing about can you eat and use edibles that are there. Let's start this one.
Don't like to cook. Can you just eat decarboxylated weed? Thanks. Well, yeah, you can. Couple more things you may want to consider before you just down a bud, but you technically can. Before I get to that, I just want to remind everybody, hit that YouTube subscribe button and notification bell, because I try to upload new videos every Wednesday. Okay, the question is, can you eat decarboxylated weed? And yes, you can. And I'm glad that you mentioned decarboxylation, because that would be important in order to activate your cannabis. And if you don't know what that is, see the comments below, because I'll have a link to my decarboxylation tutorial, what it is, why you need it, why it's important, and how to do it. It's not hard, but it is important. So can you just pop a bud in your mouth and swallow it? Yeah, you can. Some people find cannabis a little bit difficult to digest. So if you're among that group, you may not want to eat it that way, but you can. But this works really well for some people. In fact, they even grind up weed and put it into little capsules so they can just take them like with their vitamins. One thing to keep in mind, though, is that cannabis metabolizes best with fats. So if you're just going to eat some bud, I would advise eating it with something else that contains fat. Maybe take it with your morning coffee and cream, or if you have like full fat milk in your cereal, or if you're eating a meal that has some fat in it, something with some fat along with it you could use with the decarbed cannabis if you're just going to eat it plain. There's also some recipes that work well with cooking with decarbed buds that you don't have to bother with making an infused butter or oil. And see the comments below, because there'll be a link to where you can find those kind of recipes. I think buds, particularly for me, work well with like ground meat dishes, or like in heavy sauces like a marinara sauce or spaghetti sauce, things like that. It can work really well to cook with ground buds instead of making infusions. So this is another option as well. But can you eat decarboxylated cannabis? Of course you can. Eat your weed. Hope this helps. See you next time.
Yeah, I think that's very fascinating. I know that I'll speak of myself. I actually will take in the morning when I'm making my coffee. I have one of these Keurig machines. I drop a small bud in the coffee, and when it brews up, it's brewing up a little bit over between 200 to 220 degrees, 240 degrees. So I'm getting the THCA and the CBDA out of it, but it's not necessarily getting the THC and the CBD that's there, which is great. And then when I'm finished drinking the coffee, I actually eat the bud. I'm one of those people that can't eat the bud, and I don't have a problem with it. So it's something to really pay attention to. It's not just put it this way. It's kind of interesting. That's how I start my morning, and it works out very, very well. And again, I'm not getting high, but I'm getting rid of my inflammation and I'm getting rid of my pain. And I think that's really, really important. Now let's get into concentrates. This is all the fun part. This is the hash, the shatters, the crumbles, the waxes, all this good stuff. I find the best way to do it is you have some sort of a machine. I'm a big fan of dipping devices. I know their PAX has a good device that's out there. Most of the dispensaries sell something called a Puffco Plus. I think you sell Puffco Plus. Is that correct?
Yeah, we do. A lot of our patients really like it. It's pretty easy to use. You do have to be good about cleaning your concentrate vaporizers just to keep the effectiveness up. And
Right.
so just take a Q-tip and a little swab of alcohol and just rub it out. Every other use, just make sure everything's running well and the machinery doesn't get all gunked up.
Sure.
But it is a really, easy way to, travel with these. They're pretty easy to utilize. And there's just more and more options when it comes to these electronic vaporizer devices on the market as time goes on.
Sure. Sure. Now I know that this little device over here looks kind of funny. This is called a dabbing device. I know you're a big dabber. Is that correct?
Yeah, yeah, I'm a dabvocate.
Yeah. Some people like dabbing, and what you do is you put the little white tip. You explain how this works.
So yeah, another word for that kind of machine would be called a nectar collector, is another way that you can utilize that. And so basically that very tip of the unit gets nice and hot, and you take your little glass jar that has the concentrate in there, and you're just barely touching it to the edge of that concentrate while you're inhaling. And that's actually going to vaporize that concentrate. And then you're just sort of inhaling it through a straw.
Sure.
And it's very easy to use, and it's very easy to see how much you're using.
Mhm.
And then you leave behind all the rest of the concentrate that you don't want to utilize and just get on with your day.
Yeah, it's very effective, very, very effective. Now, I know that when you talk about concentrates, so why do people use concentrates? And I think this is the big answer up here, because you get the whole plant experience. You get the cannabinoids, the terpenes, and the flavonoids. If you're using cannabis for medical purposes, probably one of the better ways to consume medical cannabis, in my opinion. Now, what's interesting is they come in a couple of different options. There are those that preserve most of the terpenes and flavonoids, which are, you mentioned earlier, your resins and your RSOs, full spectrum oils, right? There's also concentrates that remove a lot of the terpenes and flavonoids. This is the distillates, the isolates, the waxes, the shatters, the butters. And then there are those that reintroduce the product into the final product, which a lot of the CO2 products do that. I think the slide is a bit dated because I know a lot of the distillates now being made for waxes, shatters, and butters are reintroducing terpenes back into the product. Is that correct?
Yeah, here at Insa, our waxes, shatters, and butters and so forth, they actually are preserving the original terpenes. We don't actually add anything back to it. We do that with our distillates, though, because we want to reintroduce some terpenes so that you're getting the entourage effect and you're
Sure.
getting, the great benefits that those different terpenes provide. And we also have some vaporizers that don't have distillate, but use like a resin or live resin. And
Right.
so nothing's reintroduced. It's just that whole plant
Mhm.
turned into a vapable material.
Right. So I know that when you take a look at how do you preserve the terpenes? Well, in the case of rosin, which is one of the most simple ways that are out there, it's like you mentioned earlier, it's like making olive oil. What they do is they take a couple of hot plates. What they do with heat and pressure, they fundamentally squeeze the trichomes and they squeeze them out into parchment paper, and that's what actually makes the rosin that's out there. It's very natural. It protects, how should I say, it preserves a lot of the components of the plant itself. And hash is much the same way. Hash is really interesting. You want to talk about hash for a second?
Sure. And so how hash is something that a lot of people, a lot of old school people who have been using cannabis for a long time are familiar with. And basically what it is we take the whole flower and we're knocking off the trichomes. And those trichomes, they may be small, but they add up. And so that creates something called keef. If
That's
you've
right.
ever ground up, if you've ever ground up flour in a grinder that has a little keef catcher, you've seen keef before. And then the hash just sort of adds very minimal heat and it compresses it to make it into almost like a puck. And so that makes it a little bit easier to break apart and very, very strong since it's just all trichomes, which is where all of those active ingredients and terpenes are created.
Right.
And a lot of the time what happens is to knock off those trichomes, the flower material is actually frozen and dunked into an ice water bath. And then that is sifted through to collect all of those trichomes away.
Kind of like a good NFL quarterback. They put them in an ice bath after the game.
Yeah.
But yeah, it's a very natural way of making it, and it preserves a lot of the actually the cannabinoids, the flavonoids, and also the terpenes. I'm a big rosin, hash, and resin fan for a whole bunch of reasons. I think they're very practical. You mentioned RSOs. Tell us about RSOs.
So RSO, just to be clear, is not something that you would usually or really ever want to smoke or inhale. RSOs are a type of concentrate that you're actually either going to ingest or you can even apply it topically to the skin. That was actually the original use for it. RSO stands for Rick Simpson oil. Rick Simpson is the originator of this type of product, and they use ethanol as a solvent. And that's pulling away just about everything out of that plant. It's pulling all the cannabinoids, the terpenes, the lipids, the flavonoids, the chlorophyll. It's pulling just about everything out of there. And so it tends to be very, very strong. And so just like, all of these concentrates, you want to take it very easy with RSO. And since you're ingesting it, and it has so many different components to it. The taste can be unpleasant. And so sometimes you'll find RSO in a capsule. But if you do have RSO in a syringe where you're just squeezing out the material, a lot of people like to smear it with a little bit of peanut butter just to make it a little bit more palatable when they're eating it. And also there's tinctures that are created with RSO as well. And so it's a pretty amazing compound. And a lot of people really like it, especially those who are looking to get the maximum entourage whole plant experience from cannabis.
Yeah, RSO was originally created, I know, for Rick Simpson had it to treat his melanoma. And that's why it was really in that particular case, it was a syringe that he rubbed on his skin. They found that now that making it into oils really works really well. And I know that it's been world famous for helping to treat cancer. But I know that in many cases, I have patients that have neuropathic problems, that have, they may have Parkinson's, they may have nerve ending problems. RSO is very effective because the whole plant helps the cannabinoids come in and be able to coat the receptors, which is what you're really trying to do to kind of treat that particular condition. It's very effective. However, it is very strong. I look at RSO like the 151 Bacardi of the cannabinoid area. So just pay attention to it. Very effective, go low and go slow, but it's something that really works. And again, I'm a big fan of RSO tinctures. I don't like the syringes, but I do like tinctures. Rosin, live resin is interesting. They basically flash freeze the flowers, right? And then they make the product itself, which is great.
Yeah, and so what they do, or at least what we do here at Insa, is we take that flower and within a day of harvest, within a day of chopping it down, we cryogenically freeze it down to -65 degrees Celsius. And so very cold. And the reason why we go through that is that we're going to preserve the trichomes, those cannabinoids and those terpenes that are created in those trichomes at the highest level and at the peak amount of freshness. I use the analogy all the time that frozen vegetables will have a higher amount of vitamins and minerals than stuff that's been sitting on the shelf because it hasn't had time to degrade because it's very often frozen right there in the field. Right. And so it's very much the same with your live resins, your live sugars. We even have live butters, which are very terpene rich. And it's really just capturing that plant at its peak freshness in a product.
Right. That's why I'm a big resin fan for that reason. Now we have a couple of good questions, and let me try to answer those. Edie asks the question: is there such a thing as a person getting too much CBD into their body? Well, first of all, let me back up and let's talk dosing for a minute. Every person's body is different. It's much like alcohol, and it's much like tobacco. I have friends who literally have one drink and they're done for the night. I have other friends of mine that'll drink the whole bottle and they're just getting started. The same thing happens with cannabis. It has a different effect on every person. I am very THC tolerant. I can handle a lot of THC. My wife is exactly the opposite. There's a little bit of THC and it affects her quite a bit. So that's why he usually uses a 20-to-1 or a 12-to-1 or an 8-to-1 product, or I'm going the other way to treat a lot of the things that I have. So I can't answer that question. It depends on you, but I do know that in most cases, CBD isn't going to hurt. Most cases, it's not going to hurt you, and you really can't take too much. But I do have some friends. In fact, I have one friend who's a community educator for one of the more popular dispensaries here in Florida, and he actually has a condition where the CBD works like THC. It works opposite for him, where he'll get actually very high from it, where the THC doesn't affect him. So again, I'm going to answer it by saying, go low and go slow and try it. But in most cases, it's not going to really hurt you. But if you're that rare exception, that 2% or 3% that it does affect, it might be able to do that. Just go low and go slow. That's really out there. Clark is asking a great question. What is the highest THC concentrate and best for pain? Wax, hash, shatter. I know there is a way to smoke RSO if it's made. Let's back up. Every person kind of has their own let's just say preference. I know that there's things called meringues that actually are they're very smooth. They're good to use. Butters are very easy to load into the vape pens. I personally, for my pain, I stick to the resins, and I stick to the hashes. Okay, because I feel they're more natural. I get a lot of what I'm looking for are the terpenes, and the terpenes are really what help me with the pain. Now, that being said, there's some great batters that are out there. There's a number of different products that really work well. Any of the concentrates are good for pain. My personal preference is to stick to the ones that are higher in the terpenes and the flavonoids. Lisa, you got an opinion on that?
Yeah, and so if you're looking for a concentrate that's going to be really high in terpene content as well as THC, then I would recommend a batter or a butter. Those tend to be really high in terpene content, and that's why their texture is the way that they are. And that's why they tend to be a little bit looser, a little bit oilier, because terpenes, are basically an oil. And that oily content that's in that concentrate is going to really oomph up, the terpene content that's in there. Now, in terms of THC content, it really is going to vary from product to product. A lot of these concentrates will start off with the same base material, and it goes through different post-processing techniques to eventually solidify it into like a wax or into a shatter. And so it's going to vary a little bit from batch to batch. But if you are looking for something that has a really high THC content and a really high terpene content, then yeah, I would say a batter, a butter, a live batter or a live butter is going to be a really great option for you.
And they're much easier to use. I know some people, shatters are very, very stiff. You can think of it like a pane of glass that you break off a little bit, you drop it in. I know the butters, the batters, they're easier. They're more like cake batters, to be able to put them in. People's preferences really depend on what they like to use.
Yep.
It's there. So it's there. Now, you talked about distillates and isolates. Why don't you tell me about those?
So a distillate is basically taking a flower material and distilling it down to a single cannabinoid, or maybe two, maybe THC and CBD, but often very just THC. And the distillate process will often just destroy the innate terpenes that are in the product. And that's why a lot of people, us included, will reintroduce the terpenes back into it after the distillation process. And why we go through all of that is because distilling it does create a really high cannabinoid content. We have had at Insa, that 98% THC vaporizer. Most of the time it's going to hover that 80-85 range, but it can get as high as 98%. And so distillates will not really have those innate terpenes, but we will add them back, either botanically derived or cannabis derived, back into it so that you are still getting that entourage effect. Isolates are almost like a crystallized version of the cannabinoids. And so whereas distillate is almost always utilized inside of vaporizer pens, occasionally you'll find it in syringes too, but isolate is almost always going to be dabbed or used with an electronic vaporizer because it becomes crystalline. When you're purifying specifically THC down to those crazy high concentrated levels, with the isolation process, it starts to become crystallized. And so you'll sometimes see products on the market called diamonds. And that's what a diamond is basically as pure to just THC as you can possibly get. Definitely not for beginners, definitely for people who are more experienced and who need that high THC content. And it's usually almost always, especially isolates, almost always THC. I haven't really seen too many CBD isolates. And
I haven't seen many. I saw one.
Yeah,
in the 10 years
they're not so common.
Yeah. So, and then there's also they called BHO, butane hash oil. You want to talk about that?
Sure. And so concentrates, the reason why they're called, sometimes people will call them BHO, is because the extraction process is using butane as the solvent. And so what a solvent is it's grabbing on to all those cannabinoids and terpenes and leaving behind the rest of the plant material, all the biomass and chlorophyll and all of that. And so BHO, and often I will just say that a lot of times they'll use other solvents as well in conjunction with butane. And so sometimes it's butane and propane. And depending on what they're trying to make, they'll do different amounts of either. And so that can create your shatters. That's like you mentioned, that really glass-like material. It'll make sometimes waxes, which, you know, are usually really solid in structure. They may melt a little bit between your fingers, but it's definitely a little bit easier to like drop into flour or drop into your electronic vaporizer. As it says here, it usually has that nice golden color to it. And butters or batters will have that really high terpene content, which is what's going to give it that wetter, almost like brownie batter in a lot of cases, texture. You know, if you ever are confused about the different kinds of concentrates and all these different names, really they're relating to the texture of the final product. So shatters are called shatters because when you break it apart, it's like a pane of glass, it's going to shatter. Waxes are called waxes because they're very much like candle wax. Butters and batters are called that because they very much resemble like cake batter or peanut butter. And so don't let those names throw you too much. It's really mostly just referring to that final texture of that end product.
Sure, it's there. Now, and then of course, there's one that's just come on the market, I think the last couple of years, called CO2 oil. You want to talk about that?
Sure. So CO2 oil, much like butane hash oil, it's using CO2 as the solvent. And so what's nice about CO2 is that it's considered very safe. It's a very gentle solvent. The only minimal drawback to a CO2 oil is that it tends to not get quite as high a THC content as your BHOs. And it's also what's considered a very closed system. And so you're not able to get as much final product from the CO2 process. And so CO2 processing will pull out some of those innate terpenes. A lot of the time it is preferred by some people who want to make sure that that flower is transformed directly into that concentrate without any sort of, you know, reintroduction of terpenes. Some extractors will add some more terpenes to the final product. But for the most part, from what I've seen, most CO2 extractions are pretty much as is, and they don't usually do too much re-addition.
Cool. Well, good. Thank you. We're going to get into different routes, to kind of do a quick summary real quickly. But before I do that, I want to answer a couple of questions that came up. One of the questions from Anonymous is, can cannabis help with a libido? That's a very good question. There are a lot of articles on this. I know that when I was in college, the answer was uncategorically yes. Okay. I have read a lot of articles, and I would say, yeah, probably it does help with that. I think a lot of it is, you know, does it trigger something in the body to cause that to happen? I think a lot of it has to do with people relax, they get somewhat euphoric, and I think it causes people to just be a little more creative. What's your thoughts, Lisa?
Yeah, we've even seen products that are specifically formulated for that.
Right.
We've seen it where it's going to increase the blood flow. And so we've actually even seen some products, we don't create them at Insa, at least not just yet, but I've seen products that are like for both genders, you know, an arousal maker, which is really cool. And I agree completely with you, is that a lot of the times cannabis can help you relax, help you let go of some inhibitions, but still allows you to really like focus in, and it increases your sensory input. And so you're able to feel everything a little bit more than you maybe would off of cannabis. And that's really nice. And you may even, depending on the terpene content of, you know, the product that you're utilizing, may allow you to, you know, enjoy it more. So, yep, absolutely.
I have a couple of friends of mine, some married couples that swear by it. So, you know, they'll be your testimonials. So the answer is I would not rule it out, and I would probably answer in the favorable category on that. So the one other question I'm going to answer is, any word on when recreation will be legal in Florida? Boy, that is the $64,000 question. Let me just cut right to the chase. Ron DeSantis is against cannabis, period, medical or recreational. Okay. His campaign financiers lost his son to a drug overdose, and he views the cannabis as a drug, which is unfortunate, but that's his position. And he's done everything he possibly can to throttle back and to really hurt the medical cannabis program. I'm not being political. I am a Republican, but I can tell you I am not in favor of what has been going on here in Florida with respect to how they handle cannabis. They could be doing a lot more to help a lot of people. Now, there are some dispensaries and there are some organizations that are dumping a lot of money into getting recreational cannabis on the ballot and getting it out there. There are some people that are saying it'll never happen. I don't think in the next year or two it's going to happen. I think there's going to have to be something in the 2024 timeframe with respect to either something that gets on the ballot and or something that comes from the people speaking to really have that happen. If we wait for the legislators in Tallahassee to make this happen, candidly, it is not going to happen. Okay, we've seen them try to limit the amount of THC that you're going to be used. They just came out recently and tried to restrict the amount that's being distributed, that they're trying to take away from doctors the capability to prescribe. They're not following science. They're following, I don't know what they're following. But I do know they're not necessarily being friends of medical cannabis. So I think that if I had to make a prediction, I would say after 2024, and I think it's going to take a new way of thinking by the politicians in Tallahassee to really make this happen. Now, that being said, when 71% of the population voted for medical cannabis, it became very hard for a lot of those politicians to oppose it. And that's why in the current governor's elections and in all the ever elections, there's no talk about cannabis at all. Because if you're against it, which is what one party is, what you're going to do is you're going to hurt your efforts. So they've tried to downplay the whole thing. I think we need to bring it out. I'm pro cannabis, obviously. I'm pro recreation and pro what they call recreation adult use, but I'm for both. But I don't think there's going to be anything that's going to be happening in the short term. I know there's a lot of efforts going on to really restrict it, and I wish I could give you a better answer to that. But that's what I personally see about what's going on in Florida. It's something where a lot of people want it, a lot of people need it. I'm a senior citizen. I live in a senior citizens community, and I can tell you in this community with senior citizens, we want recreational cannabis. Okay, now whether it's going to happen or not is a different issue. So we'll see what happens. I hope that answers your question. Let's go. We didn't cover this one very much. This is kind of a quick summary slide of the things that we talked about. I don't want to go into this too much, but I want to put this in the deck and have people be able to reference this as they go forward about the form, how much time it takes to effect, how long it works, and basically what it's used for. It's a good reference guide that's out there. Lisa, let's talk about Insa. You are now in Tampa. I think you just had a grand opening last Friday, right?
Yeah, we had our grand opening and it was great. We really appreciate everybody who turned out. We had some cool virtual reality machines where you could see our grow facility and see our, production and how we make our edibles and all kinds of cool stuff like that. And we had some really great deals for you. Yeah, and so please come see us in Tampa. If you want to order online, you can order online at insa.com. If you want to call and talk to somebody and, get some recommendations, you can call 1-877-500-INSA and they'll place the order for you. We're also available in Clearwater. We're open 8 to 8 every day at both locations. And you can even go to insa.com and, type in your zip code and it'll tell you which one's closer to you. And I do just want to point out on this slide, you may notice that our dispensaries are set up a little bit differently. And one thing that we really like to do at Insa is we kind of want to take it away from that lining up pharmacy, just a menu, order what you want and get out of there. We want to give you the opportunity to do some browsing and see what we have. We have that amazing flower bar that's sort of in the background there, where you can actually smell the product before you purchase. Because as we say, sometimes the nose knows. And
Right.
if you find that you're really responding well to those terpenes that you're smelling in that specific strain or cultivar, then you probably should go with that and try it out. If you want to see the various flavors we have for our chocolate bars, for our drops, the different styles of vaporizers, you can check that all out and really do some browsing
Yeah.
as opposed to just get in and get out.
Yeah.
Which if
I
you
really
want to
like the
just get in
store
and get out, you
layout.
can.
I really
Sorry,
like your store layout. It's very
thank
easy to look for the products, to see the different products that are there. A lot of dispensaries put the products behind the counter and you can't see them, you can't look at them, you can't smell them, for example. I know here at Insa, it was kind of like almost like a Best Buy experience where you could actually see the products, read the boxes, read the labels and things like that, which I think is just great.
Yeah, and we've actually had that philosophy since the very first day we opened up our very first store.
Mhm.
We want to be able to really give you an idea of what these products look like, what they smell like, and what you can generally expect from the experience. Everybody's different, but we want to give you, the best idea of, what's going to happen for you as possible.
Sure. Now, and again, we talked about the different routes of administration. You have quite a variety. You don't lack for products.
No,
I
we
think
don't.
you lack for approvals, of course, from OMU, but you don't lack for products.
Yeah, well, I was just going to say we have a really good lineup right now, and there's only going to be more coming down the line from our great team that's producing all of these guys. And so we have some of the best chocolates that you're going to be able to find anywhere, infused or not. Our chocolates are some of the best chocolates that you're going to find, Julian Rose. Yeah.
I have to tell you, I am a chocoholic. I've tried chocolates from everybody, and I can say you do make the best. You have a chocolatier on your staff. My compliments to you. Okay.
Yes,
It's there.
he's been in the business for over 40 years,
Yeah,
and he's been listed in publications as being one of the top 10 chocolatiers in the nation. And so we're so lucky to have Julian Rose on the team.
sure.
And he also creates our drops. We have some of the best flour in terms of terpene content because we are so obsessed with terpenes. And so if you really love to have a high terpene content in your flour, come see us,
Right.
and that translates into our concentrates. And, just come in and just see what we have, talk to our associates. They'd be happy to walk you through. Our Florida team is so amazing and so enthusiastic.
Mhm.
We are constantly sharing with each other products that we've tried and feedback that we hear from patients so that we can better serve people who come
And you
in
have a
and
whole
looking for
bunch of,
things.
well, you call them perks. I call them discounts. You guys did a really good job of, excuse me, let me go up here. You guys have, when you go to renew your card, you give people a $50, two $50 off coupons for the $75 you pay the state for your card. I think that's great. That's the best I've
Yep.
seen in the state. I've seen somebody pay the $75, but not $100. Veterans, disabled veterans, seniors, you've got a lot of different discounts that are out there. On top of that, you have a lot of loyalty points.
Yeah, we have, the best loyalty point program, at least that we're aware of, anywhere. You come in and you purchase, we want to thank you for that purchase, and we want to be able to provide something back. And so we provide those amazing loyalty points that we keep track of, no punch cards or anything like that. We keep track of all of that for you. And we have all these amazing perks. And in the instance of the new customer discount and the card renewal perks, we really want to make sure that you have the ability to try a wide range of products.
Mhm.
And so if you are interested in trying, that vaporizer in the morning and that chocolate bar at night, we want you to be able to try it without necessarily hitting your budget too hard, especially when you're just sort of in that discovery phase
Yeah.
of
And you also
figuring
have,
out what's
you also have a
working.
pretty generous return policy too. I know a lot of
Oh yeah,
dispensaries don't do that, but if you have the product and it doesn't work and you don't like it, you encourage people to come back and talk to you and you'll take care of that. I know you're very good about that.
yeah, we want you to be happy with what you have. If it's not working for you for whatever reason, come within 30 days. We'll
Mhm.
exchange it for you, get you a store credit, and you can try something else out that, may be better for you. Absolutely.
Now, also, you talk about the first, second, and third visits. You have things that are there. I know that um, you've got an excellent set of products. I mean, you talked about the exchanges that are there. I can't emphasize more. Buying these things and paying for them out of your pocket can get expensive, and you've kind of helped mitigate a lot of that by having an exchange policy that you have.
Yes, we know that medical cannabis isn't covered by insurance yet. We're hoping maybe someday it will be, but right now it's not. And so all of that cost is coming straight out of your pocket. And we want our patients to be able to access these products easier. And so that's why we offer all of these perks. And we also offer sales very often. You know, we have some really amazing sales coming up for Thanksgiving and the week of Thanksgiving. And so keep an eye out for that. And Black Friday.
Okay, so I will plead guilty. I've been waiting to buy. I bought some chocolates and things. I've been waiting to make my big purchase for your sales. I have to. Really
That's
like
smart.
Chico's and Macy's. I know they're coming, so I have to admit I'm guilty as charged. I am the coupon whisperer. I should say the text message whisperer when it comes to a lot of this.
Yeah, that's really smart. You know, sign up for Insa Insiders on our website, and it's super easy to sign up. You know, give us your email, give us your phone number if you want text messages, and we'll tell you all of the really good stuff that's happening around the corner.
Well, listen, thank you very much. I do want to kind of wrap up. We've been at this for quite some time. A lot of people ask about where I can get hemp CBD products, because that's one of the things that's out there. And I do want to mention, we have a store called My Botanical Wellness. It does not compete with Insa. It is a hemp CBD product. The reason we did that is because we tied this back to the MMTC, medical marijuana, MMTC of Florida clinics, where we have 25 doctors' clinics. And a lot of people just ask, where can I get some CBD oil? And what we were trying to do is have them not buy it from the local gas station. We're trying to, our physicians have looked at products. They have looked at the products that are the best on the market. And so it's something that's there. And first time buyers get a 20% discount. And by watching this show tonight, you can get another discount that's there. It's by MMW10. MMWW10 will get you another 10% discount. Well, let me wrap this up by mentioning that this is part of our series. We're getting towards the end of the quarter. So I do want to mention that next week, we're going to be doing, shamelessly plug, our sleep webinar, which is next week. If you have trouble with insomnia, you have trouble sleeping, please join us. And then, of course, on the 16th, if you're in the Villages area, please join us, come see us. We're going to have, again, two webinars, one seminar, excuse me, at 9:30 in the morning and one at 1:30 in the afternoon. They're beginning to fill up, so please go in and sign up. Those tend to typically sell out. Let's put it that way. And you need an RSVP. Well, we'd like to have you have an RSVP to be able to get in. And then that evening, thank you, Hurricane Ian. We're going to be doing the terpenes webinar. We'll be doing it that evening. But I would like to wrap up and say thank you to everybody for joining us. And it's also helped to contribute. We just noticed we won a couple of awards. GHP has basically made us the best, or given us an award for the best online cannabis educational platform in 2022, as well as Lady Lake gave me an award for the best alternative medicine practitioner. So thank you very much to these organizations. But a lot of that comes from really the people like yourself that are watching today. And so I know it's been a long webinar, and thank you very much for doing that, for joining us. Lisa, you have any closing comments?
Thank you so much for joining us. Thank you to everyone who asked questions. You know, asking questions is some of the best ways to learn. And so we really appreciate you, giving us those questions and an opportunity to answer them. And yeah, tune in next week. We'll talk to you about how to improve your sleep. I hope to see everybody here.
Yeah. So Lisa, thank you. And thank Insa for doing the sponsorship. Before I sign off, there's a couple of people that make this happen. Lee and Leah are in the background. They're doing the moderators. Without them, this wouldn't happen. And I want to thank you very much. They do more than just moderate. They also help put together the slides. A lot of the graphics that come in here all come from them. So thank you very much. We really do appreciate that. And I want to have a special shout out to really the lady that came up with the idea of these webinars, Alyssa Katera. She actually came up with the idea. She actually created a lot of the initial webinars that we redid and matured over the last 3 years. But without her, this whole thing wouldn't happen. So special shout out to her. I want to thank everybody for joining us. And thank you for really spending the time. I know it's been a long webinar, but hopefully, as I mentioned in the beginning, if one person can get their life back, if it can help just one person, then that's what we're really all about. Please join us next week, and please be safe this weekend, and stay safe, and hopefully we'll see you next week. Thank you very much.